So let's start the discussion of the various medical advances and various studies and news pertaining to the medical field. IV iron therapy cuts cardiovascular events in heart failure with iron deficiency. So it is seen that if a person is having heart failure and you correct their iron profile, then the recurrence of heart failure is reduced. His hospitalization is reduced. His even mortality is reduced, and this is what this meta-analysis reveals. So this I have already been advocating this, that in patient of heart failure you need to see the iron levels. It's very important. So the other news is low coronary artery calcium scores is associated with an excellent prognosis regardless of person's age. Coronary CT calcium scoring is a scoring that is done after doing a CT scan of coronary arteries. It's called CT angio. It's not actual angio. It's a CT scan. So if you go for CT coronary angiography and your CT calcium score is very low, this means you have got a good heart. Intermittent fasting shows moderately greater weight loss than daily caloric restrictions. So the study want to say that if you do intermittent fasting, that will be a little better than restricting your calorie diet. Later on we will discuss in details about this. Let's move on to the next. Low LDL cholesterol levels are linked to reduced risk of dementia. So what does it want to say? That if your cholesterol level is lower, then the chances of developing dementia is also lower. So if you are taking statins and your cholesterol level is low because of that, then it, along with the cardiac protection, it will also give a protection to your brain from alzheimer's. That's a great news. Then serum MCP1 and osteopontin may predict early renal injury in gout. So if you want to predict early renal injury in gout, these are the two tests. Okay, let's see how it benefits us physicians. Let's see. Then let's move on to the next one. This one is very spicy. Gallstones significantly associated with cancers of stomach, liver, and bile duct and kidney and bladder. So if you are having gallstones and you have been operated, it doesn't matter, but it increases your chances of cancer of stomach, liver, bile duct and kidney and bladder. It's quite fascinating. Then the other is 1 hour screen use after going to bed increases your risk of insomnia by 59%. Scientists find. You know what that does that mean? It means that if you are going to sleep and you are on bed and you are watching your mobile, then it's 59% chance increase of precipitating insomnia. If you are already suffering from insomnia, you don't have to use mobile, or you have to reduce your screen time definitely once you go to bed. And the last study is tuberculosis and its medications increase the risk of gout in patients. I've seen precipitation of gout after starting tuberculosis medicines. And okay, even rheumatic diseases, rheumatological diseases, sorry, also it precipitates sometimes. And yes, that is also that's a quite nice study, I think, and it's clinically correlating also. Who has done this study? Let's see. That's all for this time. Thanks for joining the latest news medical field.